Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, here to guide our conversation on health and wellness. Today, we're taking a close look at gallbladder surgery, specifically what to expect once that procedure is behind you and how you can support your recovery. Joining me is Alara Sky, who will share detailed insights on how this surgery affects the body and what you can do to ease common digestive challenges. Alara, thanks for being here.
Thank you, Ethan. It's a pleasure to talk about this topic, especially because gallbladder removal, or cholecystectomy, is one of the most frequently performed surgeries worldwide. In the United States alone, more than 1 million people undergo gallbladder removal each year, primarily due to gallstones. While it's certainly possible to live a healthy life without a gallbladder, many people don't realize how much this procedure can alter the way their bodies process fat and handle digestion afterward.
Let's get started by explaining exactly how the gallbladder functions and why removing it can cause digestive changes. The gallbladder is a small, pear-shaped sac beneath your liver. Its main job is storing and concentrating bile that your liver produces. Bile helps break down and absorb the fat you consume. When you eat a fatty meal, your liver releases some bile directly into the small intestine. At the same time, your gallbladder contracts to send additional, more concentrated bile to aid in fat digestion. Without that storage tank, there's nowhere for extra bile to stay until it's needed.
Exactly. After a cholecystectomy, your body no longer has a place to collect and store bile between meals. Instead, bile drips continuously into your small intestine, whether food is present or not. This can lead to several noticeable changes. One common issue is diarrhea, which occurs because the constant flow of bile can irritate your intestines. Another concern is that fat digestion may become less predictable, since the timing and concentration of bile release aren't as efficient as they once were.
I've read that a significant number of people, up to 40%, experience what's called Post-Cholecystectomy syndrome. This can include symptoms like nausea, abdominal pain, and general digestive distress that linger for months. What triggers these longer-lasting issues?
Post-cholecystectomy syndrome often happens because the body is struggling to adapt to its new bile flow pattern. Bile may enter the stomach, a condition known as bile reflux, causing burning discomfort or heartburn. Also, some individuals develop stones in the bile ducts even after the gallbladder is gone. This situation is called cholelithiasis, which can lead to infections and require additional procedures. For some people, the original gallbladder problem reflects a broader issue with digestion and bile regulation, so the symptoms persist or even return.
That's concerning. It shows that while the surgery removes the gallbladder, certain underlying issues can remain. You mentioned diarrhea and bloating as common complaints during recovery. Let's talk about ways to manage or reduce these problems after surgery.
One of the key steps is changing your eating habits. Right after surgery, it's wise to stick with clear liquids, broths, gelatin, or electrolyte drinks, until your system begins adjusting. Over time, transition to small, low-fat meals. Fat requires bile for digestion, so lower-fat dishes are easier on the digestive tract when the bile supply isn't regulated by a gallbladder. Soluble fiber is another important factor. Foods like carrots, beets, chickpeas, and okra help bind excess bile, calming the gut and reducing irritation that can lead to loose stools.
Those sound like manageable dietary changes. Hydration also appears to be crucial, especially if someone is dealing with diarrhea. When you lose a lot of fluids, your body can't function at its best. What's the best approach for staying hydrated while recovering?
Consistency is key. Drinking water steadily throughout the day, rather than gulping down large amounts at once, is more helpful for your body. Consuming bone broth or low-sugar electrolyte drinks replenishes not only fluids, but also essential minerals lost through bouts of diarrhea. People who are physically active need to be extra careful, since they'll be losing electrolytes through sweating as well. If you begin feeling weak or lightheaded, that can be a sign you're low on fluids or electrolytes.
Another important issue you mentioned earlier is bile reflux. Some individuals notice heartburn-like symptoms if bile backs up into the stomach. Besides low-fat meals, are there other strategies to curb bile reflux?
Smaller, more frequent meals can help, since large meals might flood the system with more fat than the continuous flow of bile can handle. It's also beneficial to avoid lying down right after eating. That position makes it easier for bile to travel upward into the stomach. If these simple measures aren't enough, it's important to let your physician know, since persistent symptoms could indicate a need for additional treatment or investigation.
Let's talk about potential complications. If someone who's had their gallbladder removed starts experiencing persistent pain, yellowish skin, or dark urine, what might be going on?
Those signs could point to a bile duct blockage or an infection. Retained stones, or newly formed stones in the common bile duct, can obstruct the flow of bile, causing jaundice, abdominal pain, and changes in stool or urine color. It's critical to contact a healthcare provider if these symptoms appear. Timely treatment can prevent serious complications.
Now, regarding recovery timelines, people often wonder how long they'll deal with these digestive upsets. You mentioned 4 to 6 weeks as a typical period for improvement, but it can last longer. How should someone handle it if they continue to experience issues?
If digestive problems like diarrhea, bloating, or reflux persist beyond a couple of months, it's wise to follow up with a medical professional for further evaluation. In some cases, the body simply needs more time to adapt, especially if there were additional complications or underlying digestive issues. In other instances, persistent symptoms could mean there's an unresolved problem, like retained bile duct stones. Testing can confirm whether further intervention is needed.
Let's summarize some practical steps that people can implement to improve their comfort during recovery. Start slow with clear liquids. Keep meal portions small. Choose low-fat foods. And incorporate soluble fiber. Also, maintain steady hydration and consider more frequent, smaller meals if bile reflux is a concern.
That's correct. Building on that, monitoring your symptoms is essential. Keep track of how different foods affect you. Sometimes, certain high-fiber options, like raw vegetables, might cause discomfort at first, so it's a process of gradual introduction. If a food triggers cramps or gas, wait before trying it again. Note any patterns, whether positive or negative, and discuss them with a healthcare provider if you have concerns.
Another aspect people might worry about is weight changes. Some individuals experience weight loss because they're afraid of eating anything that could trigger symptoms, while others might gain weight by relying on comfort foods that are high in carbohydrates. Is there a balanced way to manage weight post-surgery?
Yes. The goal is to focus on nutrient-dense foods, like lean proteins, vegetables, and some fruits, without adding excessive amounts of fats or processed carbohydrates. Even though you need to go easy on fat, your body still requires healthy fats in small, manageable portions. Foods such as avocados or a drizzle of extra virgin olive oil can be introduced slowly. A balanced, gradual approach is more sustainable and helps maintain a healthy weight. If significant weight changes occur, consulting a nutrition professional can be useful.
Before we wrap up, I'd like to quickly address some commonly asked questions. First, how serious is it if you continue to have digestive troubles for several months?
Ongoing symptoms that last beyond 4 to 6 weeks could signal post-cholecystectomy syndrome. While many patients adjust just fine, some do experience prolonged discomfort. It's important not to dismiss these feelings as normal if they significantly disrupt your daily life. Getting a follow-up medical opinion ensures that any treatable issues are identified early.
Next, can you still form gallstones after the gallbladder is gone?
Unfortunately, yes. Stones can develop in the bile ducts. This can lead to pain, infection, and the possibility of needing another procedure. Anyone who experiences abdominal pain or jaundice after gallbladder removal should get checked for potential retained or newly formed stones.
One final point I'd like to highlight is that everyone's body is unique. Some people return to normal eating patterns quickly, while others need more time. It's important to be patient with your system.
That's a good reminder. Recovery speed varies greatly. Paying attention to your own body's signals is key. Listen to what causes discomfort, and scale back if something isn't working. In many cases, small dietary adjustments and mindful eating habits can make a substantial difference.
Thank you, Ilara. This has been a thorough discussion on how gallbladder removal affects digestion and how to manage recovery in a steady, informed way. For everyone listening, remember that most people adjust over time, but it's crucial to know what to watch for and to stay proactive about your health.
Thank you for having me, Ethan. I hope our conversation helps anyone who has had gallbladder surgery or who might be facing it soon. Staying informed and prepared is the best way to support a smooth recovery, manage symptoms, and keep an eye out for any warning signs that need medical attention.
We appreciate you tuning in to today's episode of Dr. Mercola's Cellular Wisdom. Stay informed, take good care of yourself, and we look forward to bringing you more health-focused discussions next time. Until then, be well.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.